Good morning, everyone. Thank you for your patience. We had an extensive caucus meeting earlier today that included presentations from the Chief Administrative Officer, as well as the Sergeant at Arms, the Chief Doctor for the Capitol, as well as the Chief of Police. We also have discussed the outlines of the type of economic relief that we may need to provide to the American people as the coronavirus epidemic continues to take hold. One thing is clear, that the American people are the ones who will need the relief if Congress acts. Not the millionaires, not the billionaires, not the multinational corporations. First and foremost, the American people. We need to put families first. And over the next few days, you will hear more in that regard, and certainly today from our distinguished Vice Chair of the Joint Economic Committee. Let me now yield to the Vice Chair of the House Democratic Caucus, Katherine Clark.
Thank you, Mr. Chairman, and good morning. This week, House Democrats are focused on ensuring that American families have the information and the resources they need as they face this coronavirus public health crisis. Just last week, we invested $8.3 billion to ensure that our federal, state, and local responses are coordinated and fully funded. Thus far, however, the president has mounted a chaotic response to this outbreak and dangerously continues to contradict public health experts. We don't need tweets filled with misinformation. American families need the facts and basic resources to ensure they can protect and support their families. This includes paid sick leave, enhanced unemployment insurance, food security, and affordable testing and treatment. This is what is at top of mind for the Democrats in the House as we work to continue to understand the scope and impact of this crisis. All of our policies work together, whether that is expanding health care, making sure there's paid family sick leave, or working on making sure we are not treating our immigrant communities with bias and cruelty. This creates the infrastructure and stability that we need in times of upheaval. We cannot threaten our immigrant community and expect them to report a virus or seek medical care without being fearful. We can't champion policies that only work for the wealthy and corporations and not expect our economy to be bruised when moms and dads are unable to work. House Democrats understand this. That's why we're continuing to fight for policies that create opportunity and security for all Americans. And I'm proud to introduce Beyer from Virginia, who truly understands about economic security and is currently the vice chair of the economic, I just blanked on the name of it. Joint Economic Committee. Thank you for joining us here today, Congressman Beyer.
Thank you, Ms. Thank you, Katherine, very much. Look, the outbreak of the coronavirus is a public health crisis that has affected tens of thousands of people in the U.S. and abroad. In Virginia, there are already 5 confirmed cases, 2 in my district. I found a good friend of mine from Washington, D.C. is in the hospital right now with coronavirus. These people, their families, everyone else has been affected by the virus are very much in our thoughts. Our overwhelming concern is about public health. Lives are at stake, and this appears to be the most serious public health crisis in our lifetimes. President Trump's incompetent leadership on the coronavirus is really hurting our response, which in turn is hurting the economy. As the number of cases proliferates and fear spreads, markets have plunged into chaos, and there are even more ominous signs that more might be coming. Treasury bonds are now trading below 1% yields. That zero threshold is in sight, and it's a strong indicator of a possible recession. Businesses are suffering too because of the coronavirus's impact on supply chains. And consumer spending, which as you all know has been the main engine of economic growth, is likely to fall as Americans are forced to cut back on their usual activities, and service industries will be particularly hard hit. The effects could ripple through the economy. Goldman Sachs is now predicting zero economic growth for the second quarter. Former Federal Reserve Chair Janet Yellen has said that the coronavirus, quote, could throw the United States into a recession. The Federal Reserve, too, has little room left to cut interest rates after the cuts last year to compensate for the damages of President Trump's trade war and what they did to farmers, businesses, and consumers. So stopping all this depends on stopping the spread of the disease. And that's where the priority must be. Last week, we passed an $8 billion emergency bill to address principally the public health emergency with investments for treatment and research. And now we're in talks to figure out what we need to do next to further strengthen the response and prevent this outbreak from getting even worse. So focusing on economic systems first is the wrong approach. If we just want to protect the economy, the very first thing we have to do is protect public health and the people directly impacted by the coronavirus. This means workers who have to stay home because of a quarantine, because their child's ill, because the child's school is closed, and make sure that they receive sick pay. We don't want people having to choose between a paycheck and preventing the spread of the disease. It also means that if people can get tested and, if necessary, get treated for coronavirus without having to fear about crushing medical debt. The last thing we want is people not get tested because they can't afford it, not to get treated because they're afraid they can't afford it. It also means that ensuring that workers who are laid off because of the virus have access to unemployment benefits. And it means making sure that people, especially kids, who spend on social services for food, I think about all the kids in the Route 1 corridor in Alexandria, that these kids depend on school breakfasts and school lunches, that they don't go hungry. And it means supporting small businesses that are having to make do without employees and without customers. That's why we included some low-interest loans to small businesses in the emergency bill last week. But more can be done, and there are a lot of good economic proposals out there. The American people understand that there's a serious and growing threat to our economy, but they're still mostly concerned about getting sick. Let's be clear, the most important thing President Trump could do to protect the economy would be to lead an effective response to the coronavirus outbreak. And his performance on public health and what happens to the economy are deeply intertwined. That's why I'm so concerned. The White House has been discussing emergency measures, but so far, the president's economic efforts have considered of bluster, and confusing the public health messaging. In a crisis as serious as this one, we need competent leadership. One more thing before I turn it over to my colleague, Dr. Ruiz. 27 million Americans don't have health care coverage in this economy. Among the lower quarter, mostly our retail workers, our food service workers, 50% don't have health care, and 43 million don't have paid sick leave. Bottom line, these are the folks who could make this epidemic truly disastrous if they are not paid for when they get sick, if they're not compensated for when they lose their jobs. Bottom line, if we want to protect public health, if we want to protect the economy from the coronavirus and future outbreaks, we need to make sure that all Americans have access to quality, affordable health care and paid sick leave. We've been talking about paid sick leave for years, and it's really unfortunate that it takes a crisis like this to finally get the attention at the White House that we need. With that, let me turn this over to one of the most distinguished physicians in the U.S. House and in our country who has been giving us lots of good advice along the way. Dr. Ruiz.
Thank you. Good morning. Thank you, Congressman Don Beyer, Katherine Clark, Hakeem Jeffries for organizing this informational sessions. I'm Dr. Raul Ruiz. I represent California's 36th Congressional District. It resides in the county of March Air Reserve Base, where we had the first expatriates come to the United States. It's also the home of the BNP Paribas Open, one of the fifth largest tennis tournaments in the world that recently shut down because of the coronavirus. We depend on a tourism economy, and we have the Coachella Festival, Stagecoach Festival right now that are on the brink of potentially shutting down. I'm trained in emergency medicine, public health expert in disaster aid. I worked in the emergency departments during the 2009 H1N1 pandemic. So I see this through the lens of my experience and also my training. and I have firsthand experience. So I know what the healthcare workers, local state agencies, patients, and the American public need to know and to prepare and respond to this crisis, which has touched every major continent and already cost thousands of lives. In order to meet their needs, our commitment needs resources. That's why last week, House Democrats took early and decisive action to protect the health of the American people by passing the Coronavirus Preparedness and Response Supplemental Appropriations Act. The bipartisan, bicameral aid package provides $8.3 billion to address the coronavirus outbreak, including more than $3 billion for research and development of vaccines, therapeutics, and diagnostics, $2.2 billion in public health funding for prevention, preparedness, and response efforts, nearly $1 billion in support of state and local health agencies who are on the front lines working night and day to defend our nation's health. Rapid reimbursement is a matter of readiness capacity. If they expend their resources, they're going to need more resources to rapidly address any surge in coronavirus illnesses or spread. $500 million to extend telemedicine services to seniors all over this country, and it enables an estimate $7 billion in low-interest Small Business Administration loans to small businesses impacted by the epidemic. These funds will equip our communities and healthcare infrastructure with needs resources to help combat and prevent the spread of COVID-19. But in addition to the funding, America needs clear and consistent communication that educates and empowers people to keep themselves and their families safe and healthy. That's why we need to focus. We need to focus, and we need to act rapidly and aggressively to educate the American people. Working in post-earthquake Haiti and in other disaster situations, the most cost-effective way of saving lives in disasters is educating the people with public health education, because that empowers people to make better decisions that will help protect themselves and their families from getting and spreading the illness. So just real quick, since I have all of your attention, my recommendation as a physician and what I tell my family and what I tell my my patients would be stay home if you're sick. Number one, stay home if you're sick. Avoid close contact with people who are sick. Just note that when somebody sneezes, air droplets can travel 8 feet and last in the air for 10 seconds. So just keep that in mind. Also know that it can last on surfaces, the droplets, for a few days, so make sure you wipe those down as well. Avoid touching your eyes, nose, and ears, because that's how you get infected. The virus has to get to your eyes, nose, and not your ears, your eyes, nose, and your mouth. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. This is a method that we teach our kids in school, but just remember that you're going to still have the virus in your inner elbow and your clothes, and so if you hug your family members, you may spread it that way as well until you wash it. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. They studied the coronavirus during SARS before, and Clorox and Lysol worked really well with that. And importantly, pay careful attention to the most vulnerable in our society. And I think that's where the impetus needs to happen. People over age 60, people with weakened immune system, with underlying conditions like heart, lung disease. That doesn't mean you all aren't you all are immune. You know, people try to say, okay, if you're young and healthy, you're not going to get sick. No, you're going to get sick. It's just a matter of how bad. And many people are asymptomatic. Many people just have a mild sore throat or runny nose, a little cough. But that's not necessarily the concern right now. The concern right now is just the numbers game, where if you feel like you don't need to change your behavior, if you don't take this serious, then you're going to spread it to a lot of young, healthy people. And eventually, it's going to get in close proximity to somebody who has a risk factor like being older than 60, or even a child with severe asthma, developmental problems, or a person who has diabetes and weak immune system because they have cancer, they're taking immunosuppressants, or they have HIV. And so these are the reasons why we all should take this virus serious, to prevent those individuals from being exposed to that virus. Reports are showing that in the general public, the the mortality rate could be 1 or less than 1% in the general population. But if you have risk factors, like you're 72 with diabetes and previous heart attack, and you also have COPD, emphysema, and require treatment for oxygen, your mortality rate can be 20 to 50%. So that's why this is very important. And it's also, mortality rates also depend on a system's capacity to implement the prevention and precautions, and also to have enough ICUs and care in systems to keep people alive. That's why the supplemental package was so important now to address the information to build capacity to keep people safe and to give personal protective devices. Now, another question is, how do we enable family members to follow the instructions? Because it's one thing to say, if you're sick, stay home. It's another thing to say, if that is a single mother who relies on her check to pay her bills and food for her children, that single mother is going to say, it's very difficult for me to stay home. So that's why we are not in this Capitol Hill bubble. That we're listening to the American people. The American people say, yes, we want to follow your preventions, but if we don't have the capacity to do so, then they won't. So we have to ensure that insurance companies don't deny the paying for the treatment or the test, even if the test comes back negative. If a doctor says, I think you should be tested, then they should pay for that test. And we should also think about our students. That hasn't been mentioned, but our students who have to be quarantined or not take an exam, they shouldn't be penalized and have to pay the tuition to retake an exam that they had to miss, or a class that they had to miss due to CDC guidelines. So if we take this step, we're going to mitigate the amount of morbidity and mortality in this country from this virus. And with that, I believe we're going to take questions.
Thank you, Raul. Thank you, Don. Questions? I think Don outlined a series of steps, and so did Katherine, that we think are important for us to take, which include a robust strengthening of unemployment insurance, food security, paid family sick leave.
So that's a no. You don't believe that's right.
Thank you. Next question.
So Donald Trump just tweeted that, he said, I don't know if anything can be ready this week, and then he said that you are do-nothing Democrats, that you're going to leave town before something can get passed. Are you guys going to stay in town in order to pass some sort of stimulus?
So let me get this straight. We have a coronavirus that has killed thousands of people throughout the world already. We have a stock market that is in complete free fall. We may be heading into a recession. And Donald Trump wants to lecture us when he spent the weekend at his Florida Gulf resort. With everything happening in this country, he wasn't in the Situation Room. He wasn't in the White House. He wasn't even in Washington, D.C. Donald Trump was at a Florida Gulf resort, hanging out with the Billionaire Boys Club in the midst of a global epidemic. So we're not going to be lectured by Donald Trump about leadership when he's failed to show a scintilla of it in the midst of this whole crisis.
Do you think it is important to get something done, though, before you leave?
We're having that discussion about the appropriate way to move forward in a robust fashion as outlined by Katherine and Don.
Some economists are calling for direct cash payments to people who have been affected by the virus. Is that something that's on the table?
I yield to Don.
Yes, among many other things. One of the dilemmas with the payroll tax is that if you've lost your job, or you're in the gig economy, or many other things, you're not going to get anything. Or if you're with, like so many Americans, making $25,000 or less, it ends up being $10 a week, not enough to really do anything. So among the many things that we must consider to get this stimulus going again, direct payments will be at least part of that. So.
Oh, sorry, Katherine.
I would just like to say, in response to the question about the president, today would be an excellent day for him to drop his lawsuit to undo the ACA for millions of Americans.
Back.
Let me tell you why consistent, aggressive, early information is so important, and why the lack of that aggressiveness and concern leads to more health illnesses and will lead to more deaths. As you know, the president used a lackadaisical approach to this, was more concerned about how it would look on his presidency than the concerns of the American people, and that's why he was dismissing the seriousness of the coronavirus, which trickles down to the culture within the different institutions, and there wasn't the speed that was necessary to get information out. That causes two big problems. One is if you don't have early aggressive testing, then you don't know the extent of the virus spread, and therefore you do not have epidemiological data to base your strategic decisions on how to contain it. It's too late now. Right? There is community spread, and it's moving throughout the country, and we have people who have the virus that hasn't been tested. 1. 2, there was a flaw in the test, and CDC had to recall the test. That's another mistake that occurred, but they don't want to talk about that. They just want to entertain name callings through tweets and whatnot, but we need to address that as well. The second is these preparations that they just started, like last week, that should have been done when they first knew that the coronavirus was spreading rapidly in China and going to other countries ahead of time, so that we can have the test available to the community and the hospitals in communities to address that. So no, they did not employ the proper aggressive early detection, surveillance mechanisms that this virus warranted, and that's because of the mixed messages, the lackadaisical, the discrepancy in information, and the lack of hustle with, starting from their spokesman in chief. Yes.
What realistically can be done in the short run to protect gig economy workers and also the economy from the effects of the virus?
Well, I think you raise an important point, and we're looking at protecting all of the most vulnerable workers in our society. As Don illustrated, that includes food service workers, that includes service industry workers, that certainly includes gig economy workers. And we're operating on the basis of a few different premises. First, we want to make sure that everyone who needs to get tested can get tested free of charge, without fear of suffering economic hardship. Second, we want to make sure that if someone is feeling ill, they do not feel compelled to go to work, whether that's as part of the gig economy, whether that's as a food service or fast food worker, whether that's a retail industry worker. All of those individuals come into close contact with the American people. And we don't want them to have to choose between taking care of their health condition or their economic condition. And that's why we have a particular emphasis on robustly enhancing unemployment insurance, as well as making sure that paid sick leave is available to every single American. We hope that President Trump will join us in this effort, as opposed to trying to bail out his friends, his millionaire and billionaire buddies.
That's the concern, and the big difference here is that there's we're trying to prevent millions and billions going to millionaires and billionaires who don't necessarily need this, and millionaires and billionaires gaming the system for a trickle-down response to a crisis that is primarily hitting the most vulnerable amongst us, which are those that don't have access to health care, that don't have stable jobs, that don't have access to doctors and clinics in their communities. And that's the key. This stimulus and this aid needs to be families first, public health and safety first, and that means we have to enable the people to protect themselves, because the way that we're going to stabilize the economy is by reducing the spread, reducing the morbidity, the mortality of this disease, and that's going to be through helping people follow the recommendations and taking it serious. That's the surest way that we're going to be able to help stabilize the economy right now.
Just one small pile onto this. One of the great dilemmas of the Tax Cut and Jobs Act, as we have seen again and again, was that 85% of it went to the top 1%. And the vast amount of that was spent either on stock repurchases or on dividends. So the initial intent, which was to lift up all Americans, to get it to overcome some of the sort of the grievous income inequality that we have right now, didn't happen. So when you have more than 40 million Americans who made less than $18,000 last year, you don't have the resilience among our population economically, which then passes over to their resilience in terms of their health. So we make a lot, the president makes a lot of to-do about the strong stock market and the low unemployment rate. Those are both good. But what's really important is that every American share in that prosperity, which also means they're going to be a lot healthier.
Third row.
Can you all describe how you personally are responding to the threat of the coronavirus in your offices as well as in your districts? Are you doing anything about buying new laptops, canceling town halls, limiting contact with constituents, any teleworking going on in your offices, etc.?
Well, I'm going to yield to Katherine and then the other members, but what we have been communicating are the steps that every single American should take, and we've tried to live by those steps ourselves, which is to aggressively wash your hands multiple times a day for at least 20 seconds. And when hand washing is not available, use hand sanitizer. We are emphasizing to everyone that it is important, if you are feeling ill or as a general practice, to maximize social distancing and minimize unnecessary social contact with others, so as to mitigate the likelihood of transmitting the virus, even if you may not be symptomatic, because as Dr. Ruiz has indicated, this is a virus where you could be asymptomatic, still have it, and transmit it. And we're also emphasizing, thirdly, to make sure that you aggressively disinfect surfaces and doorknobs and any other area where the virus can be latent but transmitted. Those are practices that I believe every single member of the House Democratic Caucus, every single member of Congress has been directed to follow by the House physician, and we certainly are doing that in our office. Katherine?
I think that all the offices I know are following exactly the standards that the chairman and Dr. Ruiz have outlined. But more importantly, we also realize that we can make plans for telecommuting for our staff, but our focus is on those Americans where that is not so easy. One particular group that I keep thinking about, having hired many, many home health aides to help with my aging parents, is take that particular group. Tends to be a heavy immigrant population, underinsured or no insurance, and providing necessary life-saving care to those who are most at risk for this virus. So what are the policies that we in Congress can pass that are going to ensure that workers and families around this country can engage in the social contract that we need to have with one another to prevent the spread of this disease while not upending their entire financial future? We don't want people choosing between going to work sick and not being able to pay the rent or put food on the table. So those are the policies in Congress that we are focused on, because that is where this crisis is going to hit Americans the hardest.
No, not yet.
No.
Just real quick, there's office changes, there's district work changes, and then there's home changes that I'll talk about. So in the office, we make sure that anybody who walks in uses hand sanitizers. And before and after meetings, people visibly use hand sanitizers and shares them very liberally with anybody who comes in. We are screening to make sure that if people that are going to come in, if they're sick, not to come in, then we can take the meeting over the phone. We've already made plans in case there are certain people that have high risk of illness, severity of illness, that they may not go to work, and then making the plans for telemedicine, telework as well. In the community, have been very focused on going to the senior centers and the senior social organizations, because they know who the isolated seniors who don't have social support groups, who live alone in their trailers or in their homes, are, and have been doing, as a physician, a lot of community health outreach to them. We're reaching out to all the home nursing organizations, as well as the nursing care, to ensure that they understand they have to be at their utmost universal precautions, and their workers should have the equipment necessary. We've been talking to emergency management departments and public health departments to determine what the resource allocations in the districts are. And we're going to launch in our office short video clips in both English and Spanish to be able to disseminate wide some very basic information, because people get anxious if they don't know, and two, if they hear discrepancies and mixed information, that leads to panic. So the more people know, the more it reduces information, anxiety, and the more they're able to take matters and control, empowers them to really do something about it, and it reduces not only the panic, but also helps them do something at home. I'm a father of 4-year-old twins. They're going to turn 5 on March 22nd. And so we're really making sure that this is the time to teach them new habits of washing their hands a lot. We're going to avoid large gatherings and do activities like maybe they can swim more. We're in Palm Springs, so it's nice and warm. You can swim there. Ride their bikes around the community. And my wife does homeschooling before they even need to go to school. She's already teaching them. They have the class schedules and stuff. So those are the precautions we're taking. We're avoiding to make sure, I've called my frail elderly aunts and uncles and parents and giving them the recommendations, and I'm telling the rest of the family, if they are even remotely sick, even with a mild sore throat, to avoid going to visit my aunts and uncles who are 80 years old with diabetes and heart conditions. So those are on the personal level.
And just one small addition. One of the changes is that most of the Codels have been canceled for next week. We may not be here voting, but we will all be working. There'll be a special responsibility for each of us as members of Congress in our district to continue to be the primary information providers on what's happening. And all the legislation that Hakeem and Katherine have described, from paid sick leave to free testing and the like, that legislation has to be developed so that we can vote on it this month.
Yeah, we'll do it afterward. We're going to go to the second row, and then last question in the back.
So the steps that you have talked about here today are mostly sort of relatively narrow aimed at people who've been directly affected, either they're temporarily laid off or so forth. Are you also contemplating broader steps for the economy, more broad-based approach? And if so, would that come now, or would you assess where things are at a later date?
Yeah, we haven't had that discussion in terms of the broader dynamics connected to the economy, but we have from the very beginning suggested that instead of jamming a reckless tax cut, the GOP tax scam, down the throats of the American people, where 83% of the benefits went to the wealthiest 1%, and it did nothing for working families, middle-class folks, senior citizens, young people, the poor, the sick, the afflicted, the least, the lost, and the left behind. That was all about the wealthy, the well-off, and the well-connected. So what we suggested is that there are things that can be done, such as fixing our crumbling bridges, roads, tunnels, airports, mass transportation system, investing in our infrastructure in a meaningful way. We've laid out an outline to invest at least $760 billion. It would create at least 10 million good-paying jobs. There are certainly things that can be done to benefit the vast majority of everyday Americans, not the wealthy, the well-off, and the well-connected. But our focus at the moment is providing the type of economic relief and stability connected with stabilizing and strengthening our public health foundation all across America to deal with the immediate threat of the coronavirus. Last question? Thanks.
Are you worried about Representative Beyer not going to a self-quarantine after coming in contact with someone who's been proven to have coronavirus?
I haven't had that discussion. It does seem to me that it may be prudent for Congressman Gohmert to follow the examples that have been set by some of his past or present colleagues like Mark Meadows or Doug Collins or Ted Cruz. Thank you. Thank you, everyone.